that this vulnerable population is particularly vulnerable to a pandemic like this. You have people who are already living in very cramped accommodations, entire families living in one room. And then they're all gathered together in these incredibly crowded settlements and camps.
We witnessed that vulnerability and those crowded camps when we traveled to Rwanda with the Minnesota-based Alight last year. But today, Alight CEO Daniel Wordsworth describes an even more daunting threat.
And then they don't have running water. They don't have access to shower or bathing facilities. They have to leave their houses. They have to walk to water points. They have to walk to the shower. And then they have to line up.
It's a challenging life, Daniel says, that denies any distancing, invites illness, and intimidates those who absolutely want to help.
And now we're faced with this challenge of gearing up and being able to protect literally hundreds of thousands of people from a pandemic and a virus that scares us. And here we are in Minneapolis.
So given that, what is Alight doing today on the ground in the camps where people, again, are more vulnerable?
We're doing like three things. We have to protect people, we have to identify folks, and we have to provide care. So our first priority, protect the camps from the spread of the illness. Take people's temperature, symptoms. Get out there and educate people. Set up hand washing facilities everywhere so that people are washing their hands. The second thing is we have to identify in advance those populations that are particularly at risk, those with existing conditions, the elderly, the disabled. Find those people, and we need to be monitoring those people every single day. And then we have to mobilize our health teams to be ready to care for the sick when they arrive. And then lastly, we have to already create quarantine facilities within these crowded refugee camps.
You mentioned the hand washing facilities. Is it literally a matter of getting soap in the hands of people who don't simply even have soap or hand sanitizer?
Oh, I mean, hand sanitizer is like gold. That doesn't really exist. But we're talking about the deserts of Darfur or the plains of Uganda. But yes, we have to go door to door, and we're handing out soap, to every household, to every place where we find human beings. They need to have soap, and they need to know how to use it.
Taking steps now for when the virus comes later. It's just another act of trying to protect the most vulnerable among us.
There's an organization based here in the Twin Cities that's working around the world to try to provide the same peace of mind that we want for ourselves, for our own families, our own grandparents. We just want to give that to them, and we're their last line of defense.
Carla Holt, KARE 11 News.
At this point, Alight says the virus has not yet reached the camps where they are on the ground, but they know it is only a matter of time, and it will spread quickly when it arrives. Alight says the best way people can help now is with donations. You can learn more online at KARE11.com.